Brighton's a lovely, diverse city. It's so busy, lots always going on, real tourist town. But I think what people may not realise, there's lots of areas of deprivation in the city as well.
We've had quite a massive population increase from the last census to the current one. It was 2011, particular increases in our BME community, where we had a huge growth in about 23,000. And the other level of diversity is around deprivation, so we have some very affluent areas in Brighton. Also, sadly, in the east of our city, 6% of our children live in poverty.
At the moment, I have around 450 members through all community groups, voluntary organisations, charities in Brighton and Hove. That's about a quarter of the size of the sector in the city. There's over 2,000 groups. So the programme provides an opportunity to bring together partners from across different sectors to work together to look at how commissioning of social value is working in the city. The opportunities for that have really declined in recent years, and it's quite rare to have the resource and the opportunity to collaborate around those things.
It's really thinking, when we spend our public money, how can we do it in a way that really benefits communities, and how can we support communities to do things for themselves?
Social value is wider than commissioning. So obviously the Social Value Act is predominantly around that buying of goods and services, but actually in particular how we've taken it in Brighton Hove, how we make every public pound count, how we maximise what we get, because we are getting less and less.
We talked a lot about what we wanted to achieve, and it had to be very pragmatic. We wanted to ensure we were influencing commissioning that was happening right from the word go. So we involved some commissioners who were designing a commissioning programme, and we also agreed that we wanted something very, a product at the end of it that would inform all future commissioning and systemise kind of the approach that was taken in Brighton and Hove. And the focus really was about improving the city's approach to social value, it having been around a couple of years at that point, and people grappling with what it meant and how they needed to respond to it.
For me, it's about things like what communities are doing, what people are doing, what's the added value to the person in the community of things like volunteering, what's the added value of communities working together, and how can we sort of stimulate that, and how can we make sure that when we're procuring services, that's at the heart of it, and we're not just thinking about price, we're not just thinking for us about clinical quality, we're really thinking about how we can benefit Brighton and Hove.
I think the sector's perspectives on social value is quite different to the public sector's perspective, because it's so much about what we do. So I think sometimes we have struggled, and I count my own organisation in this, to describe our social value separately or on top of or as part of who we are and what we do anyway. So I think when we've been considering how we demonstrate our social value in commissioning, it's been a bit messy. So I guess I was looking at the programme and thinking, how could we, untangle that for us and for our members to better demonstrate that impact.
What I really hoped to achieve from the programme was raising the profile and people having something practical to use that would help them in their day-to-day jobs, with budget savings in local government and the challenges on commissioning on a much smaller budget. Having to think of more and more different things in a commissioning process is a real challenge. You want to get it absolutely right. Having not just a framework that gets that big commitment from the organisations, from your chief execs, from lead members, but something that's real for our commissioners, our procurement teams, and suppliers as well. You can talk theoretically, you can explore what the definition of social value, but actually what you want to do is get it in there, get it being used.
So we worked with Social Enterprise UK and Institute of Voluntary Action Research, and we had support in sort of helping us work out what we wanted to do in the city. Really wanted to make sure colleagues knew what it was, and as a starting to really embed it in our processes rather than something somebody knew about and it was sort of over here and we knew we had to do it but weren't quite sure what it was.
So one of the great things that the facilitator did at the beginning was, what do you want to get from social value? And each community voluntary sector, health, could all say, actually, this is what we want. And we all got a common understanding of where we were and our perspectives of it, but no one was asked to change. And actually understanding each other outside of formal procurement, outside of formal service redesign is a really great opportunity and something we don't get often. And also the time, having us keep to a programme and keep it a priority. That was a godsend.
The programme is really useful in the way in which it brings people from different areas together to learn and share their approaches and ideas to social value. There was a great exercise we did at one point where Charlotte, our facilitator, brought in examples of others' toolkits, guidance, frameworks.
We actually spent time going through lots of different documents and people saying, we like this, we don't like that, we like literally what is it you don't like, what communicates to you as a community and voluntary organisation, what communicates to you as a commissioner. We didn't discuss the definition very much, we just stole it blatantly from somebody else with a bit of a tweak. The good thing about having IVAR on was that they could say, well, this is what the other areas looked at. Well, they've had a similar conversation and they started developing a framework. We want to say, what is social value? What do we mean in this city? What are we going to do with it? And how are people going to commit to it? And what does that commitment look like in practice? So the pledge, for example, in it is really clear. There's like 6 statements of this is what we expect you to be doing. The message from the community and voluntary sector is, it's great, you're going to sign up to a framework, you know, council's going to pass it, CCG governing body will do it. Are your commissioners going to be different? What's going to be different? You know, we need to make this happen. And that's where the evolution for the guide came from. And we said, right, actually, we do need to produce something practical that we need to then back up with training and development opportunities.
I think hopefully we'll see more collaboration and more co-design in other processes as a result of people having the opportunity to be together in a room, realise how much of a shared vision they've got for things and develop a shared understanding and approach.
The foot doesn't come off the gas because we've been to committee with it now, so it's out there, it's got political support. We've committed to taking an annual report back to our Neighbourhoods, Communities and Equalities Committee in the Council with how has this been used in commissioning and procurement.
I think there is a need for training, but I really think it's an opportunity now for our commissioners, especially as funding is so tight, to really think about what the added value of the contracts are. Use social value to think about other approaches, interesting approaches, thinking beyond sort of clinical things and quality things, and really thinking about how what we do can actually help the community in ways aside from just pure health.
It helped us to fast track our work and meant we got to a product much quicker than we might have done otherwise. We weren't reinventing wheels and we could really learn from others' achievements and thinking around social value. As a CEO of an organisation in the voluntary sector, there's great pressure on training, learning and development budgets for the team, and I will often not get an opportunity to learn and develop, and I'll be very choosy about the things I engage in, but this has provided a learning and development opportunity whilst at the same time furthering our work and the sector's work in the city, so it was a beautiful win-win.